like a little aneurysm. Whoa. They're like, just stress. And I'm like,
people think that I have the luxury of walking away.
This week has been the hardest week of my life.
I'm happy it's over.
Stress does not cause aneurysms. I want to make that very clear. And I'm fairly confident that, stress makes everything worse, but stress does not cause aneurysms. As a matter of fact, there's no evidence to suggest that stress is going to even cause a known aneurysm to get bigger or rupture.
Welcome back to the GNI Podcast. I am joined today by Dr. Erol Veznedaroglu, who is a vascular surgeon at Global Neurosciences Institute. And today we're going to be talking about Kim Kardashian's recent brain aneurysm diagnosis. So the news came out yesterday from TMZ, and we're just going to, briefly read the article and, have Dr. Veznedaroglu help break down, a little bit more about aneurysms. So just to cite the TMZ article, Kim Kardashian had a scary medical discovery during the season 7 premiere of The Kardashians. She suffered an aneurysm and she's blaming Kanye West. She's basically at the doc getting a routine MRI when, quote, the little aneurysm is discovered, and she's told aneurysms can be caused by stress. And according to their definition, the aneurysm is a bulge or ballooning in a blood vessel in the brain. A ruptured aneurysm causes internal bleeding, which can be life-threatening if untreated. So I think the initial reaction for everybody was, everyone knows who Kim Kardashian is, and we're worried, what's this all about?
Yeah, sure. So, as you mentioned, my background is I'm a vascular neurosurgeon. I do both open treatments and endovascular treatments. This is pretty much the majority of my practice. And, so we see aneurysms in the office all the time. So first and foremost, the most important thing is stress does not cause aneurysms. I want to make that very clear. And I'm fairly confident that, stress makes everything worse, but stress does not cause aneurysms. As a matter of fact, there's no evidence to suggest that stress is going to even cause a known aneurysm to get bigger or rupture. Consistently increased high blood pressure, things like that, are contributing factors. But the fact of the matter is, the majority of aneurysms that rupture in patients, it's common during sleep. It's common during just completely normal activity, not when someone's doing heavy lifting or increasing the pressure in their head or blood pressure in any way, shape, or form. So that's a misconception. I think there's a little bit of a media grab there saying, headline, Kanye West caused my aneurysm. So for all of you out there that have been diagnosed with an aneurysm, Kanye West did not cause your aneurysm.
Yeah, I think it's, very interesting just to, the understanding of brain aneurysms, or at least, what we do at Global Neurosciences Institute is seeing these in an emergent setting where, somebody's being rushed to the ER. And I guess my, initial question would be, you see a lot of these MRI and, you previously mentioned the difference between maybe an MRI and an MRA. Is there, maybe want to get into that, but it seems like this was maybe just a routine body scan, and these kind of wellness body scans are becoming much more prevalent and popular. So it doesn't seem, at least from the limited information that we have, that, Kim went to the doctor because she was experiencing symptoms.
Right. Yeah. So, first let me preface that there are no details. So we're speaking in general terms here. I do not know any details and have not, seen Kim Kardashian as a patient. But in general, MRIs will not show an aneurysm unless it's a giant aneurysm. And I've already seen some of these clips out in social media, even by some other non-vascular neurosurgeons talking about MRI less than 5 millimeter. To properly diagnose an aneurysm, it's really an MRA or a CTA. And it's basically, an MRA is a magnetic resonance angiography. So it's an MRI of the blood vessels. And I'm not clear on why she got the imaging. And it is very common to find them incidentally because patients have headaches, patients are dizzy, patients have vertigo, things like that. And, now in today's age, MRIs are very common. And sometimes you can see something called a flow void, but you're really doing a full workup. And if they're saying that there's a quote unquote small aneurysm there, at some point the next step she would have had an MRA. And small aneurysms are not necessarily life-threatening and do not necessarily need to be treated. There's many patients. I have hundreds of patients that I follow every year with small aneurysms.
Got it. So yeah, if somebody does experience an aneurysm, it's not necessarily life-threatening immediately, but you continue to monitor it, and the advice that you might give somebody is maybe to, what would that be? Watch their diet or?
Yeah, and so it's a good question. The problem with aneurysms is most people do not know they have an aneurysm until it bleeds, and that's really the big worry, is that it leaks or ruptures. And if it does, it's a problem. I mean, up to 40% of patients won't even make it to call 911. So aneurysms are very serious, but they're individualized on the patient and other factors. So size is a big one. We know the average size of an aneurysm is 7 millimeters. We actually wrote this paper decades ago when we started looking at, there's a lot of misinformation, even in journals like New England Journal of Medicine, talking about a 10 millimeter aneurysm has a very low risk of rupture. We now know that's nonsense. 7 millimeters is the cutoff. 5 millimeters is really where most neurosurgeons will say this is something we can keep an eye on. But there's other factors. Cigarette smoking is a big one, particularly in males. Cigarette smoking increases the risk of rupture and growth. Something called polycystic kidney disease, which is a collagen disorder where you get these cysts in the kidneys. Those patients have a very high incidence of aneurysms. Family history, that's another big thing that we ask patients about. As a matter of fact, any one of our patients that has an aneurysm, an adult, if they're adult children, we'll have them screened with an MRA. But again, someone like, let's take Kim Kardashian. If she has a 4 millimeter incidental aneurysm in her brain, then that's usually, without family history, without any of those other risk factors, something we usually just follow. And the other big issue is the shape of the aneurysm. That's why usually you'll get an angiogram so we can get better pictures. A irregular shaped aneurysm that's 4 millimeters is at a higher risk of rupturing than a smooth-walled aneurysm that's also 4 millimeters in the same, type of patient.
Well, thank you for helping clarify, in this very short podcast. We just wanted to get something out to, help cover these medical terms that can sometimes be thrown around in a way that maybe is not necessarily exactly the case of what somebody might be experiencing. Again, we don't have all the details, but we wanted to just briefly cover generally how an aneurysm forms, how it's treated, and in this case, Dr. Vez's initial thoughts on this situation.
Yeah, and the take home is, if you there's even a question of an aneurysm or family history or somebody's talking about it, make sure you see a experienced vascular neurosurgeon, and it's not a death sentence.